My name is Kenneth Maiese from Cellular Molecular Signaling. I'm here at the 20th International Academy meeting of Cardiology, and this year again we were able to bring a large body of work, very high quality work, that is from both the clinical spectrum as well as for basic research. And I think at this particular meeting we're having a happy marriage between those. In particular, I was invited to speak about some of our new work that translates very basic science to clinical therapies for now and even in the future. It's quite interesting that the population now is increasing in age. There's been a 1% decline in mortality and death rate over the past 11 years. That's actually led to many individuals living at more than 80 years old. So that's all very promising. Yet at the same time, we have an increase in non-communicable diseases, such as cardiac disease, which is the #1 out of the top 5 diseases. Cardiac disease ranks as the very top. And even though we do have treatments for cardiac disease, such as ischemic heart disease, a heart attack, not all patients do well. Not all patients are seen in time, and really we may only be symptomatic treatment for some. And what this really needs is we're developing therapies now that may actually resolve the initial injury that a patient has, also that may be reparative, and this may involve stem cells, growth factors, or other therapies. One of the particular therapies that I talked about today was WISP-1. This is an acronym for an abbreviation for Win1 signaling pathway protein. It's part of the wingless Win system, and this system is very important because in the body it's presented in many different areas such as the heart, the brain, and the spleen, and it involves reparative of injured tissue as well as it also oversees stem cells. What I also presented though is we're developing therapy using WISP-1, which is very promising to repair cardiac tissue and other types of tissue in the body. There are other difficulties in that to repair these tissues, sometimes you have to stop pathways that lead to DNA destruction in cells. Some of those pathways are overseen by fork-head transcription factors. This is a pathway that can lead to cell death at times, and WISP is able to control that. At the same time, WISP also controls other pathways called sirtuins. Sirtuins are very interesting because they have been shown to extend cell life. They may even help us with aging. However, sirtuins and the fork-head transcription factors, as I presented today, have a very complex relationship. And sometimes one actually can increase the activity of the other. When that happens at a very high rate, then the biological outcome or the clinical outcome that we expect may be detrimental, in that you might be actually injuring cells during something as a heart attack rather than helping them. And so it's very important to know how to target these specific pathways and how to get the best clinical efficacy as well as safety. So I think as we move forward, it's a better understanding of the biology that's involved, but also very promising pathways. And I'm very happy that I was able to present today at the cardiology conference.